Hi, my name is Munachimso Bravehearth Enwereji. I'm a physician associate with a background in sports therapy, and today I'll talk about sickle cell disease. Since we're in September, this is the International Month dedicated for sickle cell awareness, which is a month designed for us to focus on the need of research and treatment for this condition. So sickle cell is an inherited red blood cell disorder that affects the hemoglobin, which is a protein found in the red blood cells, and they are responsible for transporting oxygen through the blood vessels to the vital organs. Typically, in the red blood cells, you expect the red blood cells to be disc-shaped and flexible because that's how they easily move through the blood vessels. But in sickle cell disease, unfortunately, the shape of the red blood cell is sickled, and they're less flexible, they're more fragile, and more likely to aggregate and form a clot. As a result of these properties, this can lead to a wide range of complications, which are often addressed as sickle cell crisis. And this might present in form of vaso-occlusive crisis, which means that there has been an occlusion to a blood vessel supplying a specific organ, leading to ischemic injuries. Or perhaps you can have splenic sequestration, when the blood vessel leading up from the spleen are being obstructed, blood accumulates in the spleen, which gets bigger, causing pain, and as well causing a reduce in red blood cell count. But the most severe presentation would be acute chest syndrome. This happens when a clot forms in the lungs, and there's the potential risk of causing death due to respiratory arrest. And typically patients come in with acute chest pain, breathlessness, and feel generally well. And you might also see some changes on chest x-ray. Sickle cell is actually mostly common among patients of African Caribbean background. And in the United Kingdom, 15,000 people have been affected by this condition. Roughly 1 in 79 children every year are born with sickle cell disease. But what's the cause of this condition? This is due to a mutation in the hemoglobin gene, and often it's addressed as an autosomal recessive disorder. This is because those affected by this condition are carrier of 2 copies of the mutated gene, whereas in the presence of just 1 copy of the mutated gene, they are defined as sickle cell carriers. So with that said, for a child to be born with sickle cell disease, it has to inherit a copy of the mutated gene for both parents, which are sickle cell carrier. Being a sickle cell carrier does not essentially mean that you have symptoms. You may only present symptoms when you're exposed to extreme conditions, such as being in high altitude, which induce hypoxia, which is a state of deoxygenation that leads to the sickling of the red blood cells. Alternatively, when you're severely dehydrated. How is this condition diagnosed? During pregnancy, women are offered a screening test as part of the national program to pick up sickle cell disease, especially if there are family history of sickle cell disease in the family. Or after birth, children can have the heel prick test, which is a test that is done to pick up rare condition, and sickle cell is also included in it. For those that perhaps they're not sure if they are carriers of sickle cell trait, they might discuss with the GP, who can arrange some blood tests and help them and confirm if they are or not carrier of sickle cell trait, as this may also impact in their future plan if they're considering having a family. How is this condition treated? So once you're diagnosed with sickle cell disease, ideally you have routine checkup with a secondary care specialist, who would also provide you with a crisis plan, which means in the case you're feeling well, you know what to do, and this might involve either taking some painkillers, or in children sometimes we offer prophylaxis antibiotics. This to prevent sepsis and certain form of infection, which can lead to further complications. And we also offer pneumococcal vaccination against meningitis or other form of infection. For those that are severely unwell and perhaps they cannot cope with the pain, we often advise them to come to the hospital, where they'll be well looked after by both medical and nursing staff, and according to the underlying cause of the symptoms, they will then be offered appropriate treatments, which can either be focused on pain management with opioids, or providing antibiotics if there are underlying indication of infection, or provided with blood transfusion if they're found to be severely anemic. Talking about blood transfusion, it's essential that we all offer availability to donate blood. This is because over the years there has been increase in demand of a rare subtype of blood, which is the RO subtype, and it's mostly common in patients of African Caribbean background, and unfortunately we account just for 2% of the blood donors in the United Kingdom. So by giving blood, we're actually helping and saving life, and also ensuring that people that have been affected by this condition can maintain a good quality of life.
Thank you so much.
Yes.